everyone, it is Natalie here, and today I am with my older sister.
Hey, I'm Martha.
If you guys have not kept up with me for the last few weeks, I've been doing this thing called College Choosedays. So it's basically where I talk about every major, or not every major, but I've talked about a lot of majors and just why the person I always have like a little guest with me that is in that major or has completed it, and I just ask them about it, what it is, what you do with it, and it's just meant to help you guys kind of out, like seniors in high school or people in college or anyone just curious about different majors, just kind of help you guys decide what you guys should do and why you should do it, or if you're just curious, it gives you a lot more information about it. This week we are doing why I chose nursing, and here we have a nurse with us. She's actually a nurse, she's completed it, she's in grad school already, so we are gonna have her talk about just what nursing is and why she chose it, and that was actually one of the most requested ones. So yeah, give this video a thumbs up if you guys are interested in this. If you guys are new here, please be sure to subscribe. I will also have all of those down below, but if you guys don't even care about college related videos, I do my normal videos on Fridays, so I post twice a week, so be sure to hit the subscribe button and give this video a thumbs up because nursing was the most requested video. This is my sister, like I've said, so just tell us like a little backstory of like nursing, I don't know, just about you.
Okay, so I'm the oldest sister, the one that a lot of you probably don't know exists. I am 27 and I've been a nurse for 4.5 years. I went to college at UNC Charlotte here in North Carolina, and I've been working on a surgical unit at a local hospital, and I've been working on the same unit since March of 2013. I work on a surgical unit and it's been great. I see a lot of different things, basically all surgeries except the heart and the brain. So it's been a great experience. I'm currently in grad school, like Natalie said, for nurse practitioner, and I'll be done in August. So almost seeing the light at the end of the tunnel. Still a ton of stuff to do, but it's gone by really quickly. That was a 2-year program after undergrad.
Okay, so now that you know a little bit about her, and yeah, I feel like so many of you guys don't even know I have an older sister. Here she is. If you guys watch my vlogs, then you might, but I'm not sure. So the first question that we start off with all of these videos is why, or what is it? So what is nursing?
So nursing is a service career, basically. We take care of patients when they're sick, and not only their patients, but the families as well. It's kind of a double career because you're the support system for the family also, and we basically help them heal. What else? I guess, yeah.
Basically just when you see a nurse, like, I feel like a nurse is just like when you go to the doctor, you see what nurses are.
We do different things, so that's a good point. Nurses that we see at the doctor and at the hospital have a little bit different tasks. So the ones at the doctor's office are usually what you see, like they're taking your vital signs, or they're giving you the shots, or coming to talk to you. And then at the hospital, it's a little bit different. We take a ton of patients at a time. They're 12-hour shifts, day shifts or night shifts, and we hand out medications all night or all day, depending on what unit you're on. And we're also taking care, like I said, of the family as well, and really assessing the patient, taking care of the patient, making sure that they're staying stable so they can go home. And
the next question is, why did you choose nursing?
I chose nursing, well, let me backtrack. So it wasn't ever something where I was like, oh, I want to be a nurse when I grow up. I never had a career really that I said this is what I want to be when I grow up. Maybe a princess or something like every other kid, but it was never really, I want to be a nurse. I don't have anybody that's a nurse in my family, although my grandma, my mom's mom, she is a doctor, so she was very proud of me whenever I decided to do that. But really, I guess what led me to that was nursing is a great career, and it's really a great you can go anywhere with it. You don't only have to stay a nurse, you can go into management, you can go into the provider role, like an advanced care provider, which is what I'm doing. There are a lot of different avenues you can take, but basically, as I'm the oldest and I'm significantly older than you guys, I guess I always had that maternal role, so I felt like it was really appropriate, and I did mission trips in high school, and I love serving people. So I felt like that was kind of a really good combination, and that's kind of where that came about.
Well, you started with biology.
I did. So I originally wanted to go to dental school. That was, when I was in high school, I decided I was gonna be a dentist, and so, but for dental school, you need any kind of undergrad. So I originally started as a biology major because most people in dental school, that's one of the ones that they would do. And I started as a biology major and basically failed the first bio class, the first bio test, because I didn't even last one whole semester. I think I maybe lasted like 2 weeks. And then I withdrew. I was like, this is not for me. If I end up with a biology degree and I don't end up going to dental school for whatever reason, this is not something I can fall back on. I was either gonna work in a lab or teach, and that is not me. So I sat back down and reassessed my situation, and nursing came upon, I came upon nursing, and I thought that's a really good fallback career. If I end up staying in it, that's a great career to be in, because again, there are different avenues you can take. But if I go to dental school, obviously that works too. So that's how I came upon nursing major.
The next question is, do you regret choosing nursing?
No, I don't, but there are good days and bad days. There are some days that I want to run away really fast and not go back to work. But some days, like when you have a patient who you didn't think was as appreciative come back months later to see you, or they talk to your manager about, give you a good report and you didn't even realize that they were, or even if it was a patient that was so great to you and you loved, being their nurse and everything, even those patients that were kind of expected to give you a good report, even when they do, that makes it all worth it. And then seeing their progress as well.
And then what type of jobs can you get with it? So you kind of touched on that, but also talk about what you're doing now, like grad school. And
like I said, you can do a lot of different things with it. There's a management role, where you can manage a unit, and also you can end up doing like a case management type of role with it. You can do working in a doctor's office or a hospital. And then from that, using that, if you have your bachelor's degree in nursing, you can go to an advanced role. Well, again, management with a bachelor's degree, continue to get your master's with that. And then, like I said, an advanced practice role, so a nurse practitioner, and you can do any kind. Family nurse practitioner is just general, like the ones you'd see in a doctor's office that sees kids and adults, and you can specialize. You can do the intensive care, you can do the emergency room, anything like that. So there are a lot of different things you can do with nursing, and you're always gonna have a job. So that's the best part.
And then the next question is the best university. So I actually looked that up on my phone. So the first best university, or the best university in the country for undergrad nursing, this is from USA Today, is Malloy College. I've never heard of that college in my life. But it's a private liberal arts school that is rooted in Catholic values. So it just says the nursing program immerses students in the medical field to give them a well-rounded education. I've never heard of it, but if you go there, let me know. The second one is NYU, and then the third one is Drexel.
That's your favorite.
I know,
city.
New York. So NYU, I would love to go there. That was like my dream school. And then the third is New York. I'll give you a 4 and 5 just because I'm on here. Fourth is University of Pennsylvania, which that is an Ivy League school, and then the fifth is George Washington University, which is in DC.
Well, I guess I don't go to a top school then.
Yeah. Well, that's for undergrad. So.
Okay. Oh, that's right.
Yeah.
Okay.
For undergrad, so if you want to be a nurse there. And also, I never added this into the questions I'm going to ask, but I think I'm going to start asking this question to these videos, is what type of classes do you take as a nurse in college?
Oh my gosh, that was so long ago. So definitely like your typical prerequisites, you have to take statistics. That's one of the ones you have to take. And then well, it depends. So if you do there's a difference between just being an RN, a registered nurse, and then having a bachelor's of science in nursing as a registered nurse. That's what I did. That's a 4-year degree. So some people can get a nursing degree from a community college, and it's just the same. You end up working, you have the label as a nurse in the end, and they're great nurses. I work with a lot that don't have a bachelor's degree, or I have in the past. But the difference is a bachelor's in nursing, obviously it's longer, so it's 4 years versus 2 years at a community college, but it also focuses a lot on like nursing theory and like research and that type of a thing. So in the bachelor's program, there's a couple of research classes you take, like nursing research, in addition to your like physical assessments, like learning how to assess a patient, and medications, learning medications, and learning about diseases as well. So there are a ton of different courses, and most of them obviously focus on nursing, but there are also, in addition, like the research courses that you have to take.
I just wanted to ask that because when I first started this series, I started with engineering and I didn't talk about the classes because I actually have a whole video on like the classes, so that's why I never added it. But I wanted to add it now.
Let me add this. So with nursing though, there is a difference. So in the sense of a difference between like other majors, we do clinical rotations as well. So that's like our practicum. So every nursing program, whether it's just a 2-year program or a 4-year program, and same with nurse practitioner, we do at the end of the semester, we have a practicum where we get clinical hours. So we work with a preceptor at a hospital or wherever it may be. Usually it is a hospital though. And that's our practicum. We take care of the patients and we kind of learn firsthand, side by side with that preceptor, essentially how to be a hands-on nurse. That's like the hands-on portion in addition to like your labs and stuff like that.
I just wanted to ask that because when I first started this series, I started with engineering and I didn't talk about the classes because I actually have a whole video on like the classes, so that's why I never added it. But I wanted to add it now.
Let me add this. So with nursing though, there is a difference. So in the sense of a difference between like other majors, we do clinical rotations as well. So that's like our practicum. So every nursing program, whether it's just a 2-year program or a 4-year program, and same with nurse practitioner, we do at the end of the semester, we have a practicum where we get clinical hours. So we work with a preceptor at a hospital or wherever it may be. Usually it is a hospital though. And that's our practicum. We take care of the patients and we kind of learn firsthand, side by side with that preceptor, essentially how to be a hands-on nurse. That's like the hands-on portion in addition to like your labs and stuff like that. But that's a difference too. We have X amount of hours that we have to complete.
And one last question, just because we have her here today and she's doing nurse practitioner, I just want to ask, what does an NP do in case anyone's already done nursing and they're trying to decide, or if you're going to go to nursing but you know you want to go to grad school to do something else, here's what does it do, or what do you do as an NP?
Oh, well, nurse practitioner is a lot like a PA, like a physician assistant. The only difference is every nurse practitioner has been a nurse before, because you have to be a nurse prior in order to be a nurse practitioner.
Because she is doing that right now, but she's at Duke University in grad school right now and she's studying to be a nurse practitioner, and she's almost done, like she said. So yeah, we have a Duke person and we have an NC State person. No UNC people in our house, yeah.
Nurse practitioners they work under a doctor. I mean, I think in some states they already have, and don't quote me on this, and I should probably know this, but in some states they have already a law in place where they can actually, a nurse practitioner can practice without a doctor, but this state is not one of them. But usually they work under a doctor, whether it's in the same building or you just report to a doctor, but basically you are the provider. So there are a lot of people who now, when they go to the doctor's office, like their primary care physician, their primary care doctor is a nurse practitioner. So you can prescribe, you can diagnose, basically everything that a doctor does, essentially all of those like basic things. And you can work anywhere. You can work in a hospital, you can work in a doctor's office. I don't know what all states have minute clinics, but we have a lot of them here in North Carolina, and most of the providers that work in minute clinics are either nurse practitioners or physician assistants. That's kind of what they do. They take the lead and they take charge and take care of you.
Without going to med school.
Yeah, exactly.
And you get paid more as a nurse practitioner.
Not more than a doctor, but more than a nurse.
Yeah, more than nurses, yeah.
Yeah.
Okay, So that is basically all my questions that I had, and if you guys want to see all the other videos, then definitely click down below. I'll have all of those there, and also leave requests for more majors so that I can ask my friends and try to find people in that major. I'm like asking all my friends already, so it's kind of like I don't have that many left, but put your major down below and I will try to find someone to do a video with. But thank you so much. Thank you to my sister Martha. I never call her Martha though, so it's really weird.
Like that. I can count on one hand in all of your 21 years how many times you've called me.
Yeah, that was like weird coming out of my mouth.
It's weird hearing her say that.
Yeah, I always call her Tita. That's her nickname for us. So forever, so thank you Tita for being in this video. And also follow her on Instagram if you guys want. She also posts like fashion pictures and stuff like that, because that's, I feel like, her true passion. So follow her on that, and then I will leave everything down below, but leave more requests. And thank you guys so much for watching this video, and happy 4th of July, because that is when this will be going up. So I hope you guys are having a wonderful 4th of July if you're from the US, and I'll see you guys on Friday. Bye guys.
Bye.